Okay, great. So we will get started. Sorry about that, you guys. So basically, the first question that we wanted to know, and feel free to put this in the chat, we wanted to know about your comfort level using MedicareCENTER. So do you feel like you are a pro? Are you kind of more in the camp of what the heck is MedicareCENTER? Just give us a 1 through 5. Put a number in the chat box about your comfort level using this platform. Okay, I'm seeing a couple 3s, 3 to 4. Yes, yes. 4, all right. I would say if you're in the mid range, 2, that's totally fine. If you're in the mid to lower range, you are in good company. I mean, technology clearly has challenges, and so we just have to kind of make it work for us and control the portion that we can, which is a lot of user error sometimes, and then the parts that we can't get really knowledgeable about. So if you are in a 2 to 3 range, you are in good company. MedicareCENTER is continuously evolving, so there's always room to learn. Our second question was going to pertain to training. So this is just more of a yes, no. Have you previously attended either a live training with Anna Patrick or a recorded webinar with MedicareCENTER? Go ahead and put that in the chat, yes or no. Appreciate the honesty. I figured all of our agents would say yes, so don't make me learn anything.
Hey, they will all answer yes after today since I'm here with you. So technically,
Exactly.
all those no's will now be yeses, and we'll be able to provide you resources so you can start joining me at all those trainings.
This is going to be a yes from here on out. Thank you, Anna. Okay, I see yeses, nos. Either way, it is just such, I've attended trainings and I can admit that I haven't even seen the most recent one. So that's why I'm additionally excited to have Anna with us this morning, this afternoon. Even if you've attended trainings in the past, we always encourage you to access that learning center on their platform and just keep up to date. There are constantly new features, new enhancements. MedicareCENTER is incredibly robust, and there are trainings posted monthly. So it's a great resource for everybody, self included. So we're going to go ahead and get started. I've already eaten up some of our time with our special guests this morning. Welcome to the training. We appreciate you taking the time out of your very busy schedules to be here. This is a personalized MedicareCENTER training just for our Fidelis agents. And we want to maximize your time and the time that we have with our guest speaker, Anna Patrick. She is an amazing partner, an amazing integrity partner to Fidelis, and we are just so appreciative of her taking her time and offering this up to our Fidelis agents. That being said, I know we are eager to hear about the recent updates, the enhancements, of course, the bug glitches that have been fixed, and we definitely want to allow for your questions at the end. So we're going to ask that everyone remain on mute until that Q&A portion comes, but just to manage expectations and any anxiety, don't worry, we will have ample time at the end with Anna so that you can ask. And anything that comes up in the meantime, just go ahead and put in that chat box. My entire sales team is on here and they will be helping respond to those questions. Okay. Okay, I think somebody flash forwarded that for me, so I appreciate it because I have lost ability to go through the session. Before I turn it over to Anna, I want to reintroduce or introduce you if you're newer to the Fidelis sales team, and then plug our next national webinar, and then we'll get to it. Next slide, if somebody can, please. Oops. 1 second. Okay, here we are. This is your Fidelis sales team and the territories that we cover. So as you can see, Fidelis offers sales support. We do it from coast to coast. So if you are an agent who writes business in multiple states, you may be interacting with several of us, if not all of us, at some point in your career. So I will do a real brief introduction for the newer agents on this call. My name is Marisa Knold. I'm coming to you from the beautiful and cold state of Colorado. We have an office in Westminster, it's about 20 minutes north of Denver, and I am covering Colorado and those northern central states, if you will. Out west, we have our sales director, Carrie DeVore, and our assistant sales director, Ricardo Perez. They are based out of our Gilbert, Arizona office, and they cover the West Coast, plus Illinois and Iowa, and Hawaii. We're always looking for training opportunities in Hawaii. Brad Woolard runs things out of our Rio Rancho, New Mexico office. He's responsible for a large portion of those central and southern states, one being Texas, where we are seeing a lot of growth and expansion. So if you're thinking about getting licensed in Texas, it might be a good time to do so. Talk to Brad. Nick Santmeyer is our director out east. He represents that entire coast and the Knoxville, Tennessee office, which is our most recent office out there. And then, of course, many of you know Bernadette Russo. She is our senior director of sales. She oversees the sales team, wealth of knowledge. She keeps us all in line and operating as a well-oiled machine outside of this presentation that's had a couple hiccups, but that's okay. We're rolling. We are going to put this map in the chat, so no need to urgently copy down all this information. We'll get this to you. As a reminder, we do host our national webinars with different topics. We do these the last Wednesday of the month, and we will be running these through August. So next month on the 28th, we will be covering our DSNP and CSNP madness. Keep an eye out in your emails so you can RSVP for that one. And now we can get to the reason why we're all here. I will pass the mic to Anna. As I mentioned, she has been an incredible resource, not only to our sales team, but to our Fidelis agents as well. Always available, always fielding questions when she can. A huge, huge resource and asset for us. We are excited to hear what she has to share with us this morning, and then we will answer questions at the end, and I'll turn it over to her.
All right. Thank you so much for having me here today. You know, I am big on numbers. I am a numbers person. I work at CSG Actuarial, but also Integrity. And I just looked down at my watch and it said 1111. 1111 is my lucky number. It's kind of crazy how much I see 1111 all the time. So it's just kind of crazy to think I just saw that as you turned the reins over to me. That just tells me that we have really good things planned for not only this webinar, but for Integrity overall. So thank you everybody for your time. If you've never been on a webinar with me, I would always encourage you to join. We go in depth on the different topics of the MedicareCENTER platform. And the reason why we do that is because we have really built this best-in-class technology for our agents to do business more effectively. So it's not just a CRM, it's not just a quoting and enrollment platform. There are certain features built into the system to help you sell more and to be more effective with that. So a lot of what I'm going to cover here today is really going to start getting your minds working on different ways that you could be utilizing the tool to be more effective and sell more. Because a really exciting stat that we just got data for and we were able to share recently with all of our Integrity partners and agents is that agents that fully embrace the technology are writing 63% more apps than agents that don't. So what that is incentivizing you all is to embrace the technology, because if you are doing it how we are coaching you to do it, you will sell more. And that's, I think, the most unique thing that we are doing here at Integrity is we are really trying to help you all with your client planning for not only their health, but their life and their wealth, just for the good days ahead. So we made an incredible announcement a couple of weeks ago that we acquired the domain integrity.com. So that is allowing us to host our entire technology suite underneath our integrity.com website. So most of you that are familiar with Medicare Center, I know a lot of you gave the 2s, the 3s, the 4s. I promise you, if you start being with me through the month of March, you will all answer 5. I guarantee it. We are now housing our Medicare Center platform on our integrity.com website. So if you currently are going to MedicareCENTER.com, which I'm just going to kind of quickly show you that navigation. If you go to MedicareCENTER.com, it is going to navigate you to our integrity login page. So just kind of keep in mind that you may be directed to this clients.integrity.com. You may be directed to integrity.com. We also have a integrity.com/Medicare site that some of our agents are being redirected to. It's just really based upon how your previous cookies or your bookmarks are being stored based upon how you are redirected. But wherever you get redirected to, landing page wise, you can always hit that login button in the upper right-hand corner of integrity.com/Medicare Center, and then sign into the platform. Now, what we introduced just last week, so it's been a full week because we announced this last Wednesday, is we have added some additional tools to our Medicare Center platform. So we are adding the addition to final expense to add not only final expense quoting, but also final expense policies to the system, just to really help our agents better manage not only their health clients in their system, but also their final expense or their life clients. So we did some trainings starting last Friday. We did some trainings on Monday, and we did some trainings on Tuesday that really walk you through what those changes are. So I'm going to probably, at the end of this, when I'm done presenting, I'm going to link for you all those recorded webinars. That way, if you need more information after today, you can always watch those recorded trainings so you can get more knowledge on the different features. I know today is really strategies for using the platform, your personalized agent website, the enrollment capabilities, but also going through some of these enhancements. So I want to walk you through the enhancement side first before we get into the other items go really around your personalized agent website as well as that enrollment. So if you're used to the integrity landing page here, nothing really is too dramatic changes to this dashboard page. The only big thing is your client snapshot changed. So we are now, because we are servicing your final expense clients or your life clients in the system, really opening up this platform to all of our life agents, we have restructured the client snapshot. So if you had any previous clients in that SOA sent, the SOA signed, the quoted category, we restructure them to the engaged, meaning that they're not yet a client with you, but you have been engaged with them, and you're engaged because you're sending them scopes, you have quoted them. If you had anybody that you previously had as enrolled, we've moved them over to them being a client. Now, the great thing, again, the strategy behind reasons why agents are selling more because of this platform is we are categorizing your clients for you, making it easy for you to know, okay, which clients do I need to follow up with based upon what I am doing in the system. So if I am fully embracing the technology, doing my call recordings, doing my scopes, sending those, we are going to show you, okay, you have 70 people that you are currently engaged with today. What are those next steps that you need to take to move them the next step of being a client? Or you have 336 clients, but based upon how long they've been a client, are they retained? Meaning, did they come up on a renewal with you? Are they a loyal client? Meaning they have multiple policies with you that have been on the books for multiple years, really giving you a good indication on how can I secure my clients. We do a lot of great things within our tags and our switchers and our cross-selling opportunities that really help you keep your clients retained and keep them loyal. So I'm going to walk you through those strategies here today. So that's the biggest change that you will see here. Now you can always adjust what stages your clients are in. So if you feel like you have a very retained or loyal client, and you can move them to those categories if you would like to. So that's one change. The next change is your policy snapshot. So we are now bringing any of your final expense policies that you are writing into the platform. So you'll be able to manage your Medicare Advantage as well as those final expense policies and see them here. Christina, great question. Unlinked. This is great. Great question here with the unlinked. So what we do with policy management is we are getting daily files from our carriers that we support on the platform. And you can always find out what carriers those are in our learning center. But as long as you are a client, an individual's agent of record, while you are contracted with an integrity upline like Fidelis, then we are going to start bringing in your clients' policies for you. So we will try to automatically link that policy if you have that contact in the system. So if you write a policy for Jane Smith for a Medicare Advantage plan and you have Jane Smith as a contact in the system, we will link that Medicare Advantage policy. Maybe you wrote an Aetna policy. We'll link that policy to Jane's profile. However, if you don't have Jane as a contact, those will start coming in as an unlinked policy. So then all you have to do is go ahead and link that policy to that particular contact. So what this allows you to do is from a contact's profile page, not only being able to see all of the CRM information that you're putting into the system, but now you can easily view the policies. And the number one reason I tell agents to do your enrollments in this platform is because they will automatically link to that contact profile. And it will automatically be able to pull up all of the plan benefits for you. If you're doing an application on the carrier's website, you'll just see that particular name. But if you do the enrollment here within the MedicareCENTER platform, you're going to be able to click on that plan and see the entire plan benefits. So it makes it really easy to quickly answer your clients' questions on different benefits, what they should be paying for their prescription drugs, answer quickly which of their providers were in network when you quoted them. So it makes it easy. Again, being more effective than having to then go to the carrier's website, find their plan, look at a benefits guide. So then when we get into our task list, again, nothing really has changed here in your task list, just a quick and easy way for you to track your reminders, your unlinked calls, utilizing your call recording phone number, as well as view all of your scope of appointments that you have are tracking with that 48-hour waiting period. So nothing really dramatic here. Now, let me tell you here a couple of things again about fully utilizing the platform and having one system that is going to keep you compliant. So having that particular individual's sales call being recorded, having that on the platform, having their scope, that way you are not searching for where everything is located at. It's safe and secure in one client profile. Your unlinked calls here, so this is where any of the calls that you are utilizing with your MedicareCENTER call recording phone number will automatically store here and download for you. Now, a big reason why I recommend agents fully embrace our call recording platform is because of Ask Integrity. So one of the incredible features of Ask Integrity, it is your AI digital assistant, is it can summarize your calls for you. So it can summarize your own individual calls that you are utilizing the platform for. But if you are embracing our lead center platform for purchasing leads, if you have a lead call, it can also transfer that over as well. So I don't have an exact call summary to share with you, but I want to be able to show you the different things that Ask Integrity can do for your call summaries, because it's going to help you easily follow up with somebody. So no matter how long your call was, maybe it was an hour, maybe it was 45 minutes, maybe it was a quick 5-minute conversation, we can quickly summarize the reason for the call, what your contactor requested, and then the actions that you said that you were going to take. So what do you need to follow up on? From there, we can view that transcript. Um, if we want to kind of read that conversation. If you're utilizing the Ask Integrity on the mobile app, it is going to be able to read the call to you, read all of these summaries. So I really like that mobile app. But again, giving you those exact next steps. I love the Ask Integrity and there's the call recording functionality just because it is helping our agents get better at their sales calls, getting better at your lead calls. So if you ever kind of take a step back and think, how could I get better? What mistakes did I make? How did I not close that sale? We can go back and then you can listen to that call with your Fidelis sales manager and say, hey, I didn't get this particular cross sell. I'm going to have you listen to this conversation and let me know, did I miss something? Should I have taken a different approach to this? So that has been something that I think agents, although the call recording has been, a lot of agents don't like it, right? It's been an added step for us that we have to take to better protect our clients. But at the same time, it is an incredible learning opportunity that we can fully embrace to get better. And I really like how Ask Integrity can help us with that. So great reasons there for the doing your calls on this particular platform. Now I'm going to go ahead and get into your account information over here on the right-hand side, because I want to walk you through a couple of enhancements that we made to the platform. But I first needed to let you know about your selling preferences. So if you don't mind, utilize the chat. Tell me how many of you do final expense. So if you do final expense, just type yes or type a Y. That way I know if you do final expense. And if you don't do final expense, if you want to, tell me that too. I just want to know how much time I should spend on final expense. I always like being able to kind of pivot these webinars for agents that are actually doing final expense. If you're not doing final expense, you can type in no. Tom, yes. Alan, I love that answer. Yes, I want to sell more. Yes and no. Okay, so the great thing about what we have done at Integrity is that we are providing you more opportunities to cross-sell final expense to your Medicare clients. We're doing that several different ways. And what we are doing for our health agents is giving them a great segue and conversations so we can start talking to our Medicare clients about final expense. So the first way that we are doing that is we are adding not only final expense on this quoting platform, but we are also adding final expense to your personalized agent website. So all of you that are utilizing your personal agent website, you can now have final expense quoting on there and final expense resources. So if you would like to support final expense on your quoting tool, like your MedicareCENTER quoting tool, or on your personalized agent website, just make sure that your final expense is toggled on here. In addition, you will have to come down to your active selling permissions. So you will now see life and health for these active selling permissions here. Right now, we are very limited on the data that we get for the final expense carriers that we support on the platform. So most likely, you are going to have to come down here and self-attest. So if you are contracted with any final expense carriers, you can then add those carriers that are supported on our platform here. And then if you're not yet, talk to Fidelis about getting contracted with some of these final expense carriers. So just make sure that you come down here and you self-attest. So then when you do self-attest, all of the carriers that you see on your agent website will be reflected for final expense. So anybody, again, you can put this into the chat too, yes or no, if you are utilizing your personalized agent website or not. I did a webinar and I will share these webinar links with you guys all so you can rewatch these. I'm just kind of giving you little 15-minute summaries from hour-long webinars. With your agent website, we now offer the ability for your clients or your leads to quote Medicare or final expense on here. So this is a great segue into you being able to share your personalized agent website with your Medicare clients. And you could send them a very nice marketing email or a very nice personal email saying, "Hi, Miss Smith, just wanted to let you know that I'm now offering final expense to my Medicare clients. There's really some great benefits of having a final expense plan. And what you could do is you could send them the link to your personalized agent website to educate them on final expense. And we have great resources here that are copy and paste answers to some of your clients' questions. What's the difference between final expense versus life insurance? What if I already have a life insurance policy? Do I need final expense? What does final expense cover? So some of this information, we've kind of taken all that extra work out of it for you, the agent, of explaining what final expense is and allowing you to use this content in your own social media posts, in your own email marketing to your clients. So there's great resources out here for them just to know the basics. And keep in mind, we have the know the basics for Medicare too. So you don't need to reinvent the marketing wheel when you are doing maybe a Medicare 101 seminar or trying to explain to your agents, the difference in the different parts of Medicare and my enrollment periods, because we have all of it laid out very nicely here for you on your own branded site. So it makes it really easy. If you have a website today that you manage, because maybe you're a well-rounded agent, so you have a website that really goes through life, health, wealth, PNC, ACA, and you have a section on your website, you can always just link your personalized agent website on your existing website today. But I tell agents, one thing that I really have liked agents utilizing is QR codes. I know we were trying to pull up a QR code here in the very beginning, but most of your clients are going to have a cell phone. We kind of know that. Most of them are going to have some type of cell phone where they can scan a QR code and take them to a certain landing page. So what's really great about that, and I always say COVID has changed our entire society, where people know what QR codes are if they ever went to a restaurant during COVID, because we all had to order and view the menu. There's still some restaurants here in Omaha, Nebraska that never brought that paper menu back, where I'm still scanning QR codes. So you can always create your own QR code, and you can put that on the back of your business card or on a flyer or a marketing piece. That way it can direct your clients to your personalized agent website. Now, on your personalized agent website, consumers can do their Medicare Advantage quotes and enrollments. They can just do quoting for final expense. So just kind of keep that in mind. You'll be able to kind of see how the quoting experience works for life and Medicare on this. So I would encourage you to kind of take a look at it. I'll send you some training that we did yesterday on this plan enroll site. But one of the benefits of your utilizing your plan enroll site is your clients can create their own accounts. And when your client creates their own accounts, they are able to enter in their, let me sign in here, plan enroll, test client. I think that's my username here. When your clients create their own plan enroll account, they will be able to store their prescription drugs, their preferred pharmacies. They will be able to share their health information with you, and that will link to their profile in MedicareCENTER. What did I do for this? Trying to remember what I did for my password here. I'll have to look it up and show you guys here in a second. So that's also a benefit, is that if you wanted a quick and easy way for them to be able to update their prescription drugs, preferred pharmacies, providers, that way it can really speed up that AEP meeting for you. Having them create their own personalized agent website is a great strategy for you there. So next thing I want to show you here, enhancements, as well as we're talking enhancements, is on your contacts page. So We are now allowing you to view your contacts based upon if they are a life or a health client. So you'll notice we have these new icons that illuminate on this contact list page to let you know if we have a policy in the system from policy management, if it is a health or a life client. So here is where it would illuminate if they had a health policy with you or if they had a life policy with you. And this is just based upon the policies that are coming in through policy management. Now, with policy management, again, we are only bringing in policies that are held through an integrity FMO or upline like Fidelis, okay? So all the great reasons to make sure that all of your carrier contracts are through Fidelis or through an integrity partner. So you'll be able to see life and health right here. Now, from this particular contact list, you can always quickly change their stages. So I kind of talked to you guys about how we're automatically assigning a client stage, but you can adjust that here. And then if you click on these three dots over here on the right-hand side, it allows you to view a contact. You can start a quote, whether that is a Medicare Advantage quote or doing a final expense quote. You also are then able to connect with your client. So you can start that call recording process. You can send them an email. So this is a new feature. You are actually sending it from your email. So when you click on email, if you have Outlook that you're utilizing on your computer, it will populate a new email in Outlook for you. Call scripts. One thing I really like is the enhancements that we made to your call scripts for the health side. We are prompting your organizations and your products based upon your active selling permissions. So we're helping ensuring that you are staying compliant on these calls. And then we've also added that FCC guidelines, just the call may be recorded for quality assurance or training purposes. And then this is where your scope of appointments will store here too. So we relocated the location of the scopes. So all scopes are now found in your connect option. I will let you know a couple of items that we've changed with our filtering and our tags. So I love our tags. My tags are probably the item that I spend the most time with agents when I'm trying to coach them on being strategic, utilizing the CRM component of the Integrity platform. Because we are allowed to tag our clients based upon the products that they're on, allowing us to easily filter out and sort our clients based upon, are they a MedSup client? Are they an MA client? Are they a life client, a health client, a final expense client? So we've added some additional product tags for you, the life, the health, and then the final expense. And then instead of having the client stages of SOA sent and SOA signed, you now have those as product tags. So if you send a scope from the platform, we will automatically tag SOA sent for you. And then once your client signs it, we will automatically tag SOA signed or SOA signed. So this is a great way of making sure that you are staying up to date with your clients or your leads. Did you send them a scope? Has it been 2 days and they haven't signed it yet? Which clients do you need to start following up on because they have not signed their scope of appointment yet? Or, okay, who has signed the scope and who can I now discuss plan benefits with? So this is a great way of, again, fine-tuning your clients, knowing where all of your clients are at in that entire sales process. It is so hard to remember every single client stage. So this really takes all of that guesswork out of it for you and helps you figure out what do I need to do today? Who are my clients that have signed this? So you're not constantly nagging them, right? Campaigns. So any leads that you purchase in our lead center platform automatically transfer over into this system, and we tag so you know, okay, here are my data leads that I just bought. Here are my call leads that I just received. So we are automatically tagging those lead center leads for you. Ask integrity recommendations. And this is going to be my pitch on why you need to do your enrollments in integrity. And when I say do enrollments within integrity, the MedicareCENTER platform, I'm not talking about Medicare app and I'm not talking about Medicare Link. I'm talking about utilizing the internal MedicareCENTER system for your quotes and your enrollments. So if you do the enrollment in our platform, we are able to see that plan that you enrolled them in, the plan benefits, and all of your clients' information. So what we are doing here on our back end is we are helping you retain your clients better, okay? So we are going to identify for you clients that have a strong cross-sell opportunity. So we're taking a look at that plan that you just enrolled them in, and we're saying, okay, their Medicare Advantage plan, their inpatient hospital stay is really high. You have a strong cross-sell opportunity for final expense. For hospital indemnity, or your client has a strong cross-sell opportunity for cancer or short-term care. So we can quickly pull up those and let you know which plans you should follow up with them on, okay? So it's kind of a reminder to you as well. The data tells us the more products an individual has with you, the more likely they will stick with you, retain you, and refer you to somebody else. I had an incredible conversation with an agent during AEP when I was out at some events, and I train agents on cross-selling Medicare Advantage with hospital indemnity, and you can do that utilizing the CSG tool. But this agent came up to me and said, "Hey, Anna, do you know my best leads that I have received are people that were not my Medicare Advantage clients, but their agent never talked to them about hospital indemnity. I went in, I sold them a hospital indemnity plan, and guess what? The next year, I was their agent of record for their Medicare Advantage plan because I came in looking out for them, letting them know you have these gaps in your coverage. And they told the agent, my agent never even brought the opportunity up to me, never even discussed hospital indemnity with me and why I would need it. So now I trust you because you're actually educating me on these coverage gaps and ways that I can fill these coverage gaps. So we're helping you identify clients like that and reminding you that you have these opportunities. Even if your client doesn't want a hospital indemnity, you at least inform them that they have that option. We're also going to identify you clients that are likely to switch. So now that we know what Medicare Advantage plan that they're on, if there are changes to their plan, their providers, the cost of their prescription drugs are changing, maybe they are in a certain demographic, age band, location where we see a high switcher rate. Deaf Research and Integrity Company, they do a switcher study every year that identifies reasons why clients switch. So we will tag your clients that are likely to switch. That way, come AEP, you can reach out to those people first to make sure they're not falling for those TV ads, they're not going online shopping, they're not calling into another agent or lead vendor. So we're identifying those clients ahead of time for you. We're also going to identify your clients that are in special enrollment periods. Again, helping you better retain them in case they don't reach out to another agent. So the only way that Ask Integrity recommendations work for you to help you is if you do the enrollment in our platform. And then you have these opportunities to create your own custom tag. So you can tag your clients as you see fit. So really trying to figure out what is the best way for me to manage my book of business and assigning tags accordingly that makes the most sense for you. So just keep in mind, again, that's my pitch for doing enrollments. The benefits of doing enrollments in the platform is those Ask Integrity tags. So I always tell agents, the platform is more than a CRM, more than a quoting and enrollment platform. All the things that we are doing in the system is to help our agents. So when you look at a client profile, you have an overview section here at the top, a health profile, a policies, and a connect. This was one of the biggest changes we have made. So just the layout of your client profile is going to look a little bit different. With your overview section, this is where you will be able to do your tags, update your stages, set your reminders, and then view all of your activity. You can also add your client notes here down at the bottom. Keep in mind for any of your activities, you are always going to be able to add additional activity notes to those, download, listen to your calls, add custom activity if you would like to, see the plans that you shared with your client. Again, another benefit of doing the enrollment on the particular platform is you can always see the enrollment or the application on here. So if I hit apply, I'm able to see the exact application that I submitted, the confirmation number, and I can click view to view that application. So being able to, on one particular page, see their application, see their policy, see their call recording, see their scope of appointment, makes it easier for you. On the health profile, we've added a couple of things here for you to better service them on final expense. So we've added the ability for you to enter in gender, height, weight, and tobacco use, as well as being able to enter in health conditions. These health conditions are related to health conditions that we look at for final expense. So you will be able to see that here. Now, if you have a condition outside, if you can't add your certain health condition, it's because that's not a health condition that underwriters look at for final expense. However, you can always add those under the sun conditions in their client notes section if you would like to. I'm not going to go fully in depth with all the providers and the prescriptions, but what I will tell you here is that based upon the information that you have in the health info and that you have in the conditions, when you do start a quote and you are doing a final expense life quote on the system, all of this data is going to pre-populate into this final expense quote for you, and as well as the conditions. That way, when you are viewing a quote, we are going to eliminate the carriers that your client will not pass underwriting for based upon that health information and those conditions. We're also going to show you the best benefit for your client at the best price in the very beginning. So we're not only doing a lot of the underwriting work up front for you, we're going to tell you this is the best value at the best price. So we're always going to show you those level plans first, but you can always adjust to sort by graded, modified, guarantee issue, limited pay. But the quote results page is going to filter based upon the best value at the best price. You can always adjust the coverage amount, or if you want to quote by that monthly premium, you have those capabilities to make adjustments for you there. If you want to see which clients or which products carriers we removed because of the underwriting, you can always click on show only excluded products and say, okay, my client is not eligible for this AFLAC plan because of their diabetes, or they're not eligible for this other AFLAC plan because it's diabetes within 24 months. So we do allow you for those conditions to enter in the date of the last treatment, because a lot of the final expense underwriting is based upon look back period. So again, helping you find the best ways to best plans for your clients. And then depending on the carrier, some carriers we will take you directly into their e-application. Some carriers we will just take you straight to their website where you can log in. You would probably notice here, if I go back to my overview page here, is that we are also going to flag for you clients that are eligible for a Legacy Safeguard membership. So if you're not familiar with Legacy Safeguard, I would highly recommend speaking with Fidelis about what Legacy Safeguard is, and how you can offer Legacy Safeguard to your clients. But this is also a value add. This is one of those reasons why I am your insurance agent and I am looking out for you and I want to be in your best interest, because this is a free service that you can provide to your clients. There is no cost to you to offer this. This is no cost for your client to have, but this is an incredible segue into final expense, either if you're doing this prior to discussing final expense with your client or after you sold the final expense plan. Because what Legacy Safeguard is, it's a free planning service that really allows your client to inform their family members or their loved ones on information that they need for funeral planning, what would happen if I die, kind of all my accounts that I kind of have set up. So it's really taking all of that added stress out from their family members when they are going to plan for their loved one's funeral. I always use a good example when I talk about this is because when I went through this with my mom, she told me that she wanted to be buried in her pajamas. And that is something that I would have never known unless I was really going through and talking with my mom about what does she want? Like, what are things, what type of casket would she want? What type of ring bearers, I'm not ring bearers, who does she want to bring up her casket? What type of readings or music? She also told me, do not play the song. I'm Catholic, so there was one of our Catholic songs, like, don't play on Eagle's Wings. I just don't like that song. I cry every time. I don't want people crying at my funeral. Don't play that song. And I said, Mom, I love that song. I love listening to that song. But it's just like things like that you can really have conversations with your client. That way they know that their loved ones will have all of this information when something does happen to them and they do pass away. So this is an incredible segue into then talking to them about a final expense plan and the costs associated, because as you're talking about what type of casket, do you want to be buried or cremated? A lot of that stuff is covered in the setting up the legacy safeguard. So it's a good segue into, okay, now that we have this kind of planned out, this would then cost your family members $15,000. Do you also want to set up a final expense policy? That way you're not, what you have set up is not going to be a financial burden to your loved one. So we're doing things like this within our Integrity platform that is helping you really set the tone and build that better client relationship. So you can always sign up to be part of the Legacy Safeguard, sign your clients up for a free membership, but that's what Legacy Safeguard is essentially here for you. So keep that in mind. Now, I really want to make sure that I am available to answer anybody's questions. I think that was one thing we really talked about, wanting to be able to answer your questions. So I talked you through a little bit of our enhancements, the benefits of doing the enrollments on the platform, as well as giving you some little tidbits on utilizing your personal agent website. But what questions do you have for me? I would love to be able to answer questions. Eileen, you said we do not have any tags under other. So you will need to come in here and you will need to create your custom tags. So just go to any client profile and then click on your custom tags and then click on assign new tag. When you assign the new tag, you can create up to 10 custom tags. So just go ahead and click this create new tag, and then you will be able to create that custom tag. So that's how you do that. Tom, you are correct. There's no low income subsidy eligibility. It was interesting. One of our the person in charge of the quoting and the enrollment on here, I had a great conversation with him this morning, and we brought this up in our conversation about adding that low income subsidy level to the Medicare Advantage quote. So I know that is something that is on our product roadmap.
Thanks, Anna. That's probably also very top of mind right now for our agents, because a lot of the carriers, I'm sure you're aware, have lost their tools, their eligibility lookup tools right now. So I understand where Tom's coming from. I know Eileen had another question previously, and she could probably speak to it. I have given everyone access to unmute themselves now, so you are free to ask Anna any questions. But Eileen had a question about when you are on the issue tab. Eileen, did you want to expand on that? I can read it for her too.
I'm reading it right now.
Okay.
So when you are on the issue tab and click jump to client, I don't know what the issue, I'm not sure what the issue tab is. So if she wants to unmute herself or walk me through that navigation. That would be great.
We'll give her.
I'll answer a couple of other questions on here. So David, MedicareCENTER, you can do your quote and enroll for Medicare Advantage, prescription drug plans, special needs plans, as long as you are contracted with that particular company through Fidelis or an Integrity upline. On the final expense, you can just quote, and for final expense, we are not validating based upon upline. So you're able to quote, and then we take you into the carrier's e-application from there. Your supplements, Sam, are available through the CSG app. So if you want to quote Medicare supplements, you are going to currently do that here in CSG app. Adding Medicare supplements to this particular MedicareCENTER platform is also on our product roadmap. So that is something that we talked very closely about here this morning. Okay, so Christina, I think you have a great question and just things to talk about when we're talking about Medicare Link, Medicare app, what's the difference? So essentially, I explain it this way. Before Integrity came around or before the MedicareCENTER was built, there were other quoting platforms that all of our agents were using prior to us building out MedicareCENTER. So that was Medicare Link, which is Sunfire, Medicare app, which is Connecture, and CSG app, which is the CSG actuarial platform, which CSG is also an Integrity partner. So because a lot of our agents had their client information or was used to using Medicare app and Medicare Link, we wanted to make sure that we never provided or we never took away resources from agents. We never want to make it difficult for you to do business. So we understood that a lot of you may have had client data in Medicare Link and Medicare app, which is why we are providing you access to those platforms in case you still want to use them. Just keep in mind, when you are using Medicare app and you're utilizing Medicare Link, you are no longer in the Integrity technology. So you are now outside of the Integrity umbrella. So you're being redirected to a different website. Anything that you do on Medicare app and Medicare Link does not sync with the Integrity platform. So we are eventually getting your applications if you are submitting them on Medicare app, because we are getting policy data from the carrier. We're not getting it from Medicare app. We're getting that policy and policy management from the carrier. So we are encouraging our agents to start embracing the Integrity technology. And as you attend trainings and as you utilize the platform, you'll start hearing reasons why we are encouraging them, because although those other platforms do provide quotes and enrollment capabilities, they're not doing everything that we're doing. There are some features within Medicare app and Medicare Link that we don't support that they offer, because we want agents utilizing some of our systems over there. So those platforms, they're not going away this year. I can't guarantee you when or if they will ever go away, but we are encouraging agents to use our platforms. CSG app, that's going to be your Medicare supplements, some of your ancillary quoting, where you're going to be doing hospital indemnity. And we do fully support training on CSG because they are an Integrity company. That's actually my home base. So you'll notice that when Marissa introduced me, it was CSG Actuarial. CSG is my home base. And we're actually feeding a lot of our data and a lot of our IT resources now into the Integrity platform. So you're going to start seeing way more integration with our systems and the Integrity app because of that. So that's like moving the MedSup coding into the Integrity platform.
And I got a quick question.
Yep.
So does the MedicareCENTER offer all the carriers for the Medicare Advantage policies? Example is Kaiser and ClearSpring doesn't, it's not compatible with Medicare app. It's only Medicare Link. So, jumping around from platform to platform, are you saying that MedicareCENTER is more streamlined, where all the carriers for the Medicare Advantage plans you want to sell and prescription drugs are available on that platform?
Yeah. So what I would encourage you to do is we do have this learning center here at the top, and we have these guides. So this new user guide goes through the changes that we've made, the returning user guide updates, and then the new user guide. Either of these guides, if you scroll down to the last few pages, will outline the carriers that are supported on our platform. I've asked our team to update these so they're separate files so you don't have to go through the guides. And then they have to update a couple of other ones with the which carriers we have the health risk assessments for. This one doesn't indicate it. So if you look up this guide, anything that's shown under contacts will support the carriers that we have available on the platform for quoting and enrollment. So I know you mentioned Kaiser. So we don't support Kaiser at this particular moment. So Medicare Link is the only one that does. We do have some quoting for Kaiser on CSG. We just don't have the enrollment capabilities for Kaiser. So there may be some unique circumstances and things that we are trying to work on to get some of these additional carriers added to the platform for you. So in that case, that may happen where we just don't support a carrier on here quite yet. I'll also let you know here, there's a list of the companies that we do support on the final expense as well, if you're curious to know which ones.
So if you are using Medicare app as an example, can that info be ported over to Medicare Center and start using that?
So unfortunately, we Medicare app and Medicare Link, they don't have export options to export client information to then easily import it into our system. So as of right now, we don't have any connection with their contacts. You could add a new contact, so you can individually add that new contact to the system. We've made some more options if you were importing your contacts. We've added some new fields for you to easily import them. And then if you are utilizing the mobile app, we made an enhancement with the mobile app where you can import your contacts from your phone. So if you do have a couple of clients that you at least want to get an account moved over for them, then you can do that through your mobile phone. But I know it's difficult when, again, I think that's why we still have those Medicare app, Medicare Link links for you, just because if we don't support every single carrier, or if your client data was stored in the other system, I know some agents have said, Anna, I made it my New Year's resolution to move over 10 contacts every single week. And I said, I am so proud of you for doing that. So although it could take some time moving over contacts, in the long term, I think you'd be very grateful that you did do that.
Anna, it's Marisa again. You touched on HRA. Do you mind showing where agents can find that chart? Because I think that's a question that's come up a lot.
Yeah, so unfortunately, when we made the update to the
Gotcha.
platform, they forgot to move over that guide.
Okay.
But they will be, I think I may have one stored on my computer that I can look up. But they will put that HRA guide into these guides by topic. Let me see if I can find on my, let me see if I can find a couple of previous ones that I had downloaded. That way they can reference which ones we support on the HRA.
Yep, that's a very helpful chart. It essentially shows which carriers will automatically populate that HRA upon the enrollment submission. And it depends on if we're using agent to complete form themselves versus send enrollment link to client.
Yeah.
So there's a nice chart that she's finding. I know we're at 12 o'clock here in Colorado time, and we promised an hour, but we had a little bit of a rough, clunky sort of start. So I will allow more time because I know our agents have questions. You can just ask away.
Yeah,
I've got
I'm gonna
questions in my
link
head
here
on behalf
too.
of you.
I'm gonna link here. I just put a link in the chat. It's gotostage.com/integrity. If you want to watch some additional trainings. I just did one again on all of the changes that we made to the platform. This Life Center one is more focused to newer agents on the life side that were introduced to the platform. There's one right here for Plan Enroll Personal Agent website where we spend an hour just on your personalized agent website and what we call profile linking. So you can always utilize this link to watch recorded webinars. And then I also just sent the March webinar schedule out to our marketing team. So they're going to be posting the March webinar schedule here for you. That way you can always attend some live trainings with me on everything integrity technology related. MedicareCENTER, Lead Center, Plan Enroll, CSG, I cover all of it.
And another quick question. I know all the platforms do a pretty good job with the medication lists and do that drug analysis, but what about the providers? I find that it's very inaccurate on all the platforms. I usually go to the carrier direct. So is that something being worked on?
The biggest thing that I have seen agents with the providers is the locations. So that is why we introduce our multi-location provider search, where we are seeing agents add providers, but they're adding a location that is not in network, and therefore their quote results page is coming back saying that that particular individual is not in network. So that was been like the first thing I always encourage agents to do is when you are looking at a provider, notice how you can add multiple locations. To take a look at that, because I have seen where you can add these additional locations and not every single location's a network. So that's one thing I always kind of tell agents just to double check. And then if you do see one that is not in network, that's not consistent with what you were seeing on the carrier's website, I would always email that over to our support team so they can figure out why that is happening so we can get it corrected. So you can always contact support by clicking this need help. We have our support email. So what I would recommend doing is just like sending them a screenshot of the carrier's website, the provider, the location, and then what you entered into the system too. So if it's truly wrong, we have to let us know so we can look into that because of how we're sourcing the information. We just need to check that.
Wait, so is that only for MedicareCENTER? What about Medicare app or link? You have no control over those two.
Medicare, a lot of the data that we are driving into the integrity platform is powered by Medicare app. So a lot of like anytime you're running quotes, looking at benefits, looking at cost of prescription drugs, providers being in network, that should match apples to apples from what you see on Medicare app and then the integrity platform. Because they are feeding us data for that. So that should match. So if either of the platforms are inconsistent with what you're seeing on the carrier's website, email our support team so we can kind of get to the reasons why that's not showing correctly.
Okay, so all the data then is what you're saying is coming from Medicare app, and then you guys are enhancing the MedicareCENTER with all of your extra nuances that you're putting on your platform.
Yeah.
Okay.
Yeah. I'm sorry, I know we're over time, but I had another call that started at 12, another training that I have to jump on. So if anybody has any additional questions, go ahead and send me an email, apatrick@csgactuarial.com, and I will be able to answer your specific questions that way too.
We so appreciate your time, Anna. Thank you very much. I will put your email in the chat for everybody, and we will return your time back to you. Thank you for joining us, and we'll see you soon.